Hi, everybody. So the next section we're going to talk about is the chapter on treatment and therapies. So if you remember our hand, remember this? What's the thumb? Psychodynamic. We're going to talk about what psychodynamic therapy looks like. How about cognitive therapy? Behavioral therapy. We're actually going to combine those two and make cognitive behavioral therapy. It's its own kind of therapy. It's kind of combining the two, but you'll see how that works. Our last one, I don't have my ring on right now, but the ring finger is humanistic therapy, and we're going to talk about that. And then the little pinky, remember we know very little still about biological. We're going to talk about actually psychopharmacological and other biological treatments. And basically explore some of those, how they're used today. But first, we're going to actually go to the history of treatment, which honestly is kind of gross, kind of interesting. And so why don't we go there for just a minute? Okay, so let's start with the historical development of treatment. We talked about in abnormal psychology, we talked a little bit about how people who had bizarre behaviors or abnormal behaviors were often thought of that maybe it was because of the moon. Sometimes they thought it was because of evil spirits. They usually, before they ever decided that it was something biological, they really believed that it was because of something outside of the person was causing them, this, whatever the issue was. So the treatment also reflected that. The ancient treatments, exorcism. Again, if a person is believed to be basically possessed by demons or spirits, they were going to exorcise those demons or spirits out of them. They might also cage them like animals, beat them, burn them, castrate them, mutilate them, blood, replaced with the animal's blood. Again, none of these really fared very well for the patient. They usually ended up dead or not well at all, and eventually dead from infections and the whatnot. Another treatment that we talked about in our last chapter was trephination, where they would actually drill a hole into the head of a patient to let some of the evil spirits out. Other things they might do, again, leeching might be something that they would do. But eventually they figured out that those did not work, and psychotherapy came up with, originally kind of by Freud. He did what we call psychodynamic therapy or psychoanalytic therapy. But psychotherapy itself is therapy for mental health disorders in which a person with a problem talks with a psychological professional. It's also called talk therapy. A lot of times this is an emotionally charged, confiding interaction between a trained therapist and someone who suffers from psychological difficulties. This is what Sigmund Freud's office would have looked like. As you can see here, you would come in and lay on the couch, and Sigmund would sit behind you in the chair and just take notes. There was a reason that he would sit behind you. It was because then he would not be a distraction or be a part of your process when you were talking about random things, that it was all coming from your unconscious or your subconscious mind. So psychoanalysis. It is an insight therapy that is based on the theory of Freud. Again, it's emphasizing the revealing of the unconscious conflicts. Remember that weird one that Freud talked about, that you wanted to have sex with your opposite sex parent and kill off your same sex parent? Well, the reason you don't remember having those wants is because you have shoved it down into your unconscious, and it causes conflict within inside of you. So by being able to talk it out in psychoanalysis, Freud believed it would bring the conflict to the surface and you would become aware of it. So Basically, we would try to bring repressed feelings into the conscious awareness where the patient can actually deal with them. This theory presumes that healthier, less anxious living becomes possible when patients release the energy previously devoted to the id, ego, superego conflicts. Kind of interesting how all these things we've been talking about are now coming around full circle, right? The causes of psychological problems, according to Freud or according to psychoanalysis, it's the undesirable urges and conflicts are repressed or pushed into the unconscious. The unconscious conflict exerts influence on behaviors, emotions, and interpersonal dynamics, and understanding and insight into the repressed conflicts leads to recognition and resolution. Once you can get recognition and resolution, you are living a peaceful, happier, more joyful, fulfilling life, according to Freud. However, there were some criticisms, to say the least, of Freud. Originally, theory lacked in scientific research for support. Remember, to make something valid, you have to be able to test it, and it has to do what you say it's going to do. Freud dismissed any ideas that didn't fit with what he was trying to do. The other comments or other evaluations was, well, Freud focused on sex a lot. And the other thing that some people didn't like was his practice was very non-directive. Basically, the patient came in and just was told to talk, but about nothing in particular. And Freud, or even his successors after him, didn't ask pointed questions at all. They just allowed the people to talk, because the thought was the more they talked, the more the unconscious would come to the surface. Today, we do have modern day psychoanalysis. It still does not have a whole lot of scientific support, and it needs the client to be smart and verbally expressive. If somebody doesn't like talking about their feelings or doesn't know how to, they're not going to find a lot of, this isn't going to be a good, effective therapy for them to do. Other dynamic therapies today they're shorter in term. So psychoanalysis originally would take 2 to 5 years, going 4 times a week. That's a lot of therapy. That's a whole lot of therapy. And so it was a very long-term and arduous process. Now it is definitely a little bit more short-term, very goal-oriented. There are specific goals that are hopefully attainable for the patient. Therapists are more directive than traditional psychoanalysis, and traditional psychoanalysis is really seldom practiced today. Okay, let's move on to humanistic therapy. It is an insight therapy focused on conscious, subjective experiences and people's sense of self. So, if you remember when we kind of originally talked about humanistic, I talked about how it is based on relationship. And I know you're going to have to give me a minute to get there, but it will come back to relationship. So in humanistic therapy, there's emphasizes choices and potentials to change, or potential to change. So it believes that basically all people are pretty good, and that in order for us to grow, we have to remove the obstacles that block our personal growth and potential for self-actualization. This was developed by a guy named, this is pretty modern, by the way, a modern kind of therapy. It was developed by a guy by the name of Carl Rogers. It is also called client-centered therapy. The therapist uses techniques such as active listening with genuine, accepting, empathetic environment to facilitate the client's growth. He is giving the client, a very important term for you to know, unconditional positive regard for the clients. Oops. Okay, so I'm going to pretend that I'm a humanistic therapist for just a moment, and the way he would talk to a client would be, he would be very focused on you. He'd be looking at you very intently. He'd be leaning in. And if you were talking, let's say about, I'm having really a lot of problems with my mom, he would be like, so I hear that you're really struggling with your mom. That must be really difficult. Yeah, it is. It's really difficult. Well, tell me more about that. And he would honestly do a lot of mirroring, which means kind of repeating back what you say. He may summarize it in certain ways, but we're going to actually stop here for just a minute and have you watch a video of Carl Rogers do therapy. It's about a 13-minute video, but he does therapy with this woman named Gloria. And I want you just to notice how his body language is. He leans in. He's very intent on what she's saying. However, he never gives her any answers. That's probably one of the things that frustrate people most is he doesn't tell her what to do, and it seems to frustrate Gloria too sometimes. But it's very interesting of just how he kind of helps her come up with some of the solutions of what maybe the real problem is for Gloria. He also will never be judgmental in that. And so again, watch that unconditional positive regard. We'll get to Gloria and Carl Rogers in just a second. Also, just know that in humanistic therapy, people need to accept themselves as they are while working towards fulfilling their potential. So some of this is about self-acceptance. So the therapist does try to develop an atmosphere of trust and understanding. Again, that thing we called unconditional positive regard. The therapist acts as a mirror to the client, reflecting ideas and concepts. And the therapist does not judge the client. Thoughts, feelings, and ideas represent a person seeking to grow and seeking to be understood. So I'm going to go back to the idea that I told you earlier, though, that basically humanistic psychology can sometimes be, or it is around relationship. The idea of that little piece of it is that why do most of us why do we make changes in our life? It's usually for somebody else. And so in the therapy process, the idea is that the therapist does not, number one, want the client to want to change because of them. But in order for them to become a better person for themselves. And so it's the relationship with themselves that really is being challenged. Okay, so right now what I'm going to have you do is I'm going to have you click pause on this video. I'm going to have you go back to the page that this video is on in Canvas, and right below it you're going to find this video that you see right here, but you can't play it off of this slideshow. Is Carl Rogers and Gloria counseling. Okay, so I'll wait here for you to come back, and then when you're done with the Carl and Gloria video, come back, start play, and we'll get going again. Okay. So although you may have been a little frustrated with how Carl Rogers dealt with Gloria, I hope that you could see how he really did give her as much positive regard as he could. This positive nature actually helps the negative connotation that therapy had before. Because think about it. When people thought of therapy before, it was very perverted because of how Freud addressed counseling. If it was so much about sex, people didn't really want any part of it, especially if you came from a religious background or something like that. That was seen as being very weird. And so people didn't want a part of it. But Carl Rogers was able to change the perspective that people had on therapy with the way he did it. It was unstructured and subjective, though, so results were difficult to measure. What does self-actualization actually look like, right? How do we know if we've ever attained it, and will we ever attain it? Okay, this leads us on to behavioral therapy. Remember, behavioral therapy are things that are learned. So it's an action-based therapy on the principles of classical and operant conditioning. It's aimed at changing disordered behavior. It's more about what people are doing, not what their internal processes are, of course, because behavioral does not care about how you think or why you think about something. It just cares about what you are doing. So they use behavioral modification and behavioral conditioning. We use this a lot with children, maybe giving them reward systems, reward charts in order to change some kind of behavior. Okay, so here's a fun little story. Joe has been seeing a psychoanalyst for 4 years for treatment of the fear that he had monsters under his bed. It had been years since he had gotten a good night's sleep. Furthermore, his progress was very poor, and he knew it. So one day he stops seeing the psychoanalyst and decides to see something different. A few weeks later, Joe's former psychoanalyst meets his old client in the supermarket and is surprised to find him looking well-rested, energetic, and cheerful. "Doc," Joe says, "it's amazing. I'm cured." "That's great news," the psychoanalyst says. "You seem to be doing much better. How?" "Well, I went to see another doctor," Joe says enthusiastically, "and he cured me in just one session." "One?" the psychoanalyst asks incredulously. "Yeah," continues Joe, "my doctor is a behaviorist." "A behaviorist?" the psychoanalyst asked. "How did he cure you in one session?" "Oh, easy," says Joe. "He told me to cut off the legs of my bed." Dun-dun-dun. Okay, so anyways, but again, the psychoanalyst really would have looked at what does the monster represent in the person's life versus a behavior is just, hey, let's get rid of the monsters. If you don't want monsters under your bed, then don't make a space under your bed. Cut off the legs and the monsters have nowhere to live. So, behavioral therapy attempts to change behavior using the techniques of learning. They assume that abnormal behaviors are results of inappropriate learning. So basically, we have to learn how to do it differently. One way, believe it or not, is sometimes like through alcohol or alcoholics will use behavioral therapy or what's called aversion therapy. If you remember, the unconditioned stimulus, there is a medication that the response is it causes nausea, especially if you put alcohol with it. So alcohol plus the medication equals nausea, which then in turn conditions it so that alcohol creates nausea. Okay, another tool that we use in behavioral therapy is called a token economy. If you remember, you might remember this a little bit when we were talking about learning. This is way back in chapter 4. We used operant conditioning procedures to reward desired behaviors. So again, maybe in school, you had to collect marbles in a jar or tally marks or something like that. If you took music lessons, maybe you collected stars. Sometimes reading programs will collect stars for how many books you read, and once you meet a certain goal, they give you a special treat. Patients exchange a token of some sort and earned for exhibiting the desired behavior for various privileges or treats. Okay, this moves us on to cognitive therapy. This is a therapy in which the focus is on helping clients recognize distortions in their thinking and replace distorted, unrealistic beliefs with more realistic and helpful thoughts. So, a lot of cognitive therapy is used to really treat depression. It involves giving clients tools or techniques to identify and replace distorted thinking. And it's based on the belief that our thoughts impact our behavior. So if thoughts can be identified, then maybe we can change those thoughts, which will then result in changes in behavior. Okay, so I have another pause button for you. I'm going to have you go ahead and pause this right now and go to the next slide, which is a TED Talk by Brené Brown. She is one of my favorite TED Talks. We may have talked about her briefly in class, but what she talks about are shame-based messages. Shame-based messages are those thoughts that we may have gotten those messages from other people growing up. Maybe it was our parents, maybe it was peers, maybe it was siblings, maybe it was ourselves, and some of them come from culture. But if we, of what either expectations are on us or what it means to be good enough. How many of us, though, have some area in our life that we don't feel good enough at? So Brené Brown talks about shame-based messages, which are the messages that say, I'm not good enough. I am not smart enough. I am not pretty enough. I am not handsome enough. I am not thin enough. I am not fat enough. I am not muscular enough. I am not lean enough. I am not enough. We get this message a lot of times, again, from other people. Sometimes we get it by comparing ourselves to somebody else, because we put that person maybe up on a pedestal and said, well, if I was like that, then I would be good enough. Anyways, this is really a form of cognitive, how cognitive therapy works, is by learning how to come up with how to identify those shame-based messages. So watch Brené Brown and then come back and we'll finish our lecture. Well, I hope you enjoyed that video with Brené Brown. She is one of my favorite people to listen to. She has actually a really great Netflix special. If you liked this, there's a second video on TED Talks that really is excellent, and it talks about how vulnerability is something that can help our shame. But her video on Netflix is actually wonderful. It kind of talks a little bit about what you just heard, but just expands upon it. And so when she was talking about shame-based messages, in a cognitive therapy, what we would do is have you really identify what are those messages that you tell yourself. What makes you feel not good enough? And then that would be an example of distorted thinking. Now, something that we do in distorted thinking is we often magnify or minimize distortions of thinking in which a person blows negative events way out of proportion to their importance, or ignoring relevant positive events. So saying things like, I'm always doing this, or nobody ever calls me, or you get what I'm saying? It's magnification. It's making things always or nevers. Nevers would be minimization. Personalization. We distort the distortion of thinking in which a person takes responsibility or blame for events that are unconnected to the person. And so, have you ever had somebody come in and tell you about their bad day, and all of a sudden you go, oh, I haven't been supportive enough of this person, and you start blaming yourself, even though their story had nothing to do with you. They were wanting to vent about what was going on in their lives, but suddenly we made it about ourselves. Again, cognitive therapy will help us identify when we do things like that, because that is all examples of distorted thinking. So cognitive behavioral therapy is basically combining cognitive and behavioral. It's an action therapy in which the goal is to help clients overcome problems by learning to think more rationally and logically. They focus on the present, not the past, but recognize not everything is just an unthinking automatic response to stimuli. It does use classical and operant conditionings to learn more positive, useful responses, thinking identified as distorted. So it's a kind of a nice combination of the two. It's using rewards to encourage us to think more positively. I want to address really quickly group therapy. Some people feel like group therapy is not for them. If you have Kaiser insurance and you need to go to counseling, the first thing they will most likely do is refer you to group counseling because that is their treatment model there. And some people really shy away from that because they don't want to be vulnerable and open to everybody. However, I will tell you that group therapy can be a really excellent tool. Family counseling is actually considered group therapy. It's a form of group therapy in which family members meet together with the counselor or therapist to resolve problems that affect the entire the entire family. It's the belief that an individual is a product of their environment and also impacts the environment. Other categories of group therapy could be couples and marriage therapy, again, because there's more than one person in the room. Self-help groups, which are support groups, are composed of people with similar problems who meet together with that. It can be without a therapist or a counselor, but it can also be with a counselor or a therapist present. So like AA, Alcoholics Anonymous, or Narcotics Anonymous, there are tons of different kinds of self-help groups out there. Overeaters Anonymous. If you're familiar, in church settings now, they have what's called Celebrate Recovery. It's the same idea, though. They have a 12-step program that is led by their own members. And so, again, another great help, and it is about supporting each other. Here's the advantages to group therapy. It costs less. If you go in for individual therapy, and let's say you do not have insurance to cover, you're paying probably around $100 per session out of pocket. That adds up really quickly. You think, well, $100 isn't big. Yes, but let's say you go once a week, 4 times a month. That's $400 going to a therapist. That can really empty the pocketbook really quickly. Group therapy is usually somewhere between $30 a session to $60 a session. So it is much less expensive. Other thoughts about it? You're exposed to other possible tools and techniques, and there's a lot of voices in the room to challenge those distorted thoughts. Not just a therapist, but other people to say, hey, that's not true, or hey, have you thought about looking at it this way? And because you have those different voices, you have that social and emotional support coming from those people who are not necessarily related to you. I led for a little while a group for women who were struggling with basically their weight and overcoming that. It was not a weight loss group, but it was a group to help people really identify the obstacles getting in the way of becoming healthier in their lives. And just the way these women spoke into each other's lives, it was incredible. I honestly sometimes felt like I didn't even need to be there because they did such a great job in supporting each other, in challenging each other. They even threw a baby shower for one of the ladies. I mean, it was just a really neat group of women who were able just to pour into each other's lives and try to, while making a difference in their own. Here are some of the disadvantages. Well, even though they go over the rules and, we're supposed to, what goes on in group stays in group, sometimes secrets don't feel confined. The other thing, there's no one-on-one time with a therapist in that setting, and some don't actually have a trained professional there. This could also be a very difficult place for shy personalities, especially if you have a person in the room who tends to be, kind of more outgoing and kind of might take over the conversation a little bit. The shy person, on the other hand, will kind of just become a wallflower and sit to the side, and they won't really participate, and that can be hard. Groups aren't for everyone. The paranoid, not a great place for them. Schizophrenics, really not a great place for them, because again, that paranoia can get in the way. Okay, we are going to take a break here. We're going to move on to basically the psychopharmacological, but I thought we'll take a break, and that will be its own slideshow. So join me for the last slideshow on that, and we'll see you soon.